Hello everyone. So in this video, let us discuss on how to tackle the final MBBS examination. Some of my juniors have asked me about this, and also when I was in final year, me and my friends, we also had a few questions regarding the final MBBS examination and how to tackle it and how to study in the pre-final and final year. So if you are in the pre-final and final year now, watch this video to get an idea about the strategy and about the plan that you need to have in your pre-final and final year. So the first question that a lot of people ask, and it's a very simple question, is that whether the final MBBS examination is difficult or not, or the final year is difficult or not. And the answer is yes, it is difficult. So you would want to know, why is the final exam, why is the final year difficult? It is difficult not because there's many things that you won't be able to understand or many things that would require a tremendous IQ level or something like that. It is difficult because it deals with 4 subjects, and these 4 subjects are the main pillars of the medical life, of the medical practice that we have in the real world. Except ophthalmology and otorhinolaryngology, that is eye and ENT, all the other 4 subjects, medicine, surgery, obs-gynae and pediatrics, are taught in the final year, and they are the main pillars, the major load that every doctor faces in the real life. And these make up the maximum number of patients that are admitted in a hospital. Moreover, the number of subjects might look like 4, but actually there are a lot of subjects inside them. For example, medicine has dermatology and psychiatry, surgery has anesthesia and orthopedics, radiology is incorporated in medicine, surgery as well as obs-gynae and pedi as well. So you will actually have to study a lot more than just 4 subjects, and that is why final year and final exam is difficult, because it is unlimited. The syllabus is actually unlimited. There is no defined syllabus, and in theory you can still follow some guidelines and you can still set a question paper according to a prescribed syllabus and a prescribed format. But in the Viva examination, an examiner can ask you anything from any part of the subject. The next question is, I am in final year, when should I start? The answer to this question is, you should start after this video ends, right? That is, you should start ASAP. You are already in final year and you have already begun your classes. Maybe at present they are stopped due to this lockdown, but this lockdown will end at certain point of time, right? And you shouldn't wait till that time. You should study from your home as much as you can and at least be somewhat prepared for the exam. If you are in the pre-final year, you have plenty of time. Please focus on the subjects that you have in the pre-final year. Don't just get carried away by the final exam and start studying medicine, surgery, obs-gynae and pediatrics excessively. That's not required. You have enough time. Do study the basics of medicine, surgery, gynae and pedi, but don't go too far, right? Please focus on the subjects that you have now, and you can spare just a little time for the other subjects. Another mistake that a lot of students make is that they focus on medicine and surgery only, because if you talk volume wise, those two are the biggest, they are the vastest. But a common experience that every students face before the exam is that they realize that they don't know anything about obs-gynae and about pediatrics, especially about neonatology, because some parts in pediatrics you can definitely derive an answer from medicine, but that is the respiratory diseases, some cardiac diseases, etc. But neonatology, it's a totally different world, and you need to know the specific answers, the specific points, the specific topics regarding neonatology, and you cannot do it just before the exam. So you need to have a basic idea. You need to visit the neonatal part of your hospital as well, and at least have an idea on how things are done there, like how to weigh the neonate, etc. Because until and unless you watch that thing happening, you won't be able to remember it and perform it in the examination. There are some reflexes which you need to elicit in a neonate, like Morrow's reflex. So until and unless you have done it in the real world, in the exam, in front of the examiner, it's very difficult to carry out those reflexes. And if you don't know the exact manner in which the neonate is going to respond, you won't be able to say whether you perform the reflex correctly or not, right? So it is very important that you visit your clinical posting, you visit your wards, not only for medicine and surgery, but for all the subjects that you have in the final year, because the examiners actually ask a lot of questions based on practical experiences, and they may not be written in books, they may not be written in notes, they may not be shown in YouTube videos, right? So you need to be there in real time, in the real world, and you need to watch procedures, you need to watch other things that are carried out in the wards and the operation theater in case of surgery. So I have mentioned this point whenever I have taught instruments, whenever I have taught operative procedures, steps of operative procedures, that the best way to learn about instruments, the best way to learn about operative procedures, and the best way to learn about clinical examination is watching them in the real world and doing the things yourself. Of course, you are not going to carry out an operation, carry out a surgery at this stage, but you can definitely watch surgeons carrying out the procedure, and the instruments definitely you can handle with your own hands. So it's a request that please visit the wards, please visit the OT and everything that is related to practical, not only for your exam, but that is the thing which you are going to do in the real life, right? After your final year, you are going to be an intern, you will be posted in the hospital, and you will have to face patients' relatives, and everything that happens in the real world. No book is going to save you at that time, no video, no teacher is going to save you at that time. You have to save yourself. So until and unless you have the real world experience from this stage, you will find yourself in deep trouble in internship. And not only internship, since you will become a doctor, you have to face this real world, you have to face real patients, you have to be present in the ward throughout your life. If you become a surgeon, you have to be present inside the OT throughout your life, right? So if you don't visit the OT, if you don't visit the ward, if you don't visit the practical demonstration classes, there is no point in becoming a doctor at all, because you are escaping, you are fleeing from the real things, right? You can't just sit at home and just study things from book. This is not a theoretical field, right? Everything is related to the real world, and anything that is not related to the real world, you just have to remember for the exam, and you can definitely forget about it later on. And to emphasize more on this point, I always give the example of learning how to drive a car. For example, I take two people and they don't know how to drive a car. Person A attends lecture classes, studies from a book on how to drive a car for 1 month, and I take a theory exam and he gets full marks on it. Person B doesn't study anything from the book. He sits in the driver's seat on day 1 and starts driving the car. He makes mistakes, maybe he hits small things here and there and brings about scratches and other dents and stuff on the car, but on day 30, he is the person who is going to drive from point A to point B in the real world, and the person A can only write answers, can only tell you on the method of how to drive a car, but he has never been on the driver's seat, and that is why after a month, person B is going to be the real driver. He is going to drive the car better, and person A will not be able to drive at all, because he has never been on the driver's seat, he has never held the steering, pushed the gear, right? So if you have learned driving, you would definitely realize that the best method to learn driving is to drive a car. There is no alternative to it. There is no school, there is no tutorial, there is no YouTube video on how to drive a car. The best method to learn is to drive the car yourself. Definitely you are going to need help. Definitely there would be someone beside you, behind you, around you. Yeah, definitely you will get a lot of help. You will make a lot of mistakes, but trial and error is the best way to learn things. And just think about it, how did our generation learn the use of computers and mobile phones and other electronic devices? Have we ever gone through any manual or any guidebook? We haven't. When I was in class 2, we got our first mobile handset, Nokia 3310. I didn't even look at the guidebook. I just held the phone in my hands and I switched it on, switched it off. I went through the menu, I maybe blocked the phone, I activated stuff which were not supposed to be activated. Yeah, I made mistakes, but I learned it the best way, and I'm sure that you also have done everything like that. So why not this medical field? So why not the process of becoming a doctor is also similar to that? So why after getting into a medical college you shift to the theory, you shift to the academics and do not pay any attention to the ward or clinical posting? This is not to be done at all, right? Definitely books are important, definitely examinations are important, and you need to pass the examinations, but nothing is as important as being in the ward, nothing is as important as knowing the clinical skills and gaining your clinical skills and acumen. And the more you interact with patients, the more you carry out procedures or at least observe the procedures being carried out, the more you learn. There's no doubt about this method. So I hope that after this lockdown ends, after the situation becomes conducive, all of you would start attending wards sincerely and put your interest in the real clinical field, right? And believe me, that is definitely going to help you in theory also, because theory is nothing but a guidebook to what happens in the practical world. What you see happening in the practical world, you can always correlate that after reading from a book. That is, the practical should be correlated with the theory, and it is not vice versa. Don't study the chapter on breast on day 1 and on day 2 go and visit a patient of CA breast. Visit the patient of CA breast on day 1, know what she is suffering from, know her symptoms, know her treatment modalities, know everything, and then come back home and on day 2 study CA breast or the whole breast from the book. This is the best method to learn about anything. So the next question is that how much do I need to study? See, the answer is as much as you can. There is no prescribed time, there is no prescribed pages, books, nothing that you should study 100 pages a day or you should study 1 page a day. There's nothing like that. You should study as much as is important for you to know and as much as is important for the exam. And you know yourself best. You have been studying like maybe for the last 20 years, so you know how you can perform well and how you can learn new stuff. Some people learn it better when they say watch a video. Some people learn it better when they study from a book. Some people learn it better when someone explains it to them. So there are different modalities, there are different methods of people to learn. Choose your best method. There are a lot of methods available. You have your books, you have this app. I have talked about nearly everything that is important for theory and practical in the app. So you have got a lot of help. So please do utilize it. The strategy that you can follow is visit the ward, and the case that would be taught in the ward on that day, please study that case after you return to your hostel or home. And like this, utilize each and every day of your posting. Suppose you study a case on thyroid on one day, the next day study a case on gallbladder, on the next day study a case on the breast. So like this, even in 2 weeks of clinical surgery posting, you can finish at least what is important for your exam. You'll have to visit the OT also within this time span. So in the OT also, please visit those OTs at this stage which are important for your exam and which are easier to understand for you at this level. There's no need to stand in the OT for 8 hours and watch a Whipple's procedure being done. You would feel elated and you would feel overwhelmed that okay, you have watched a Whipple's procedure. There's no wrong in doing that, but make sure that you have watched the basic procedures, you have watched what is important for your exam, and then definitely you are most welcome to watch anything that you feel like. If you have an interest in surgery, you can definitely watch Whipple's, you can definitely watch anything that you feel like. In my final year, I used to always visit the OT, and sometimes even before the professors and other people used to come in, I used to sit patiently and I used to stay till the OT got over, say around 5 o'clock or something, and I used to watch every OT that I could not get my hands on, I could set my eyes on, sort of. So I had watched APR, I had watched total colectomy with ileoanal anastomosis using circular staplers, linear staplers. I had watched a lot of laparoscopic procedures being done, mostly lap chole. Lap chole is also important for your exam. So make sure that you watch what is important for you at this stage, and after you have completed it, after you have that confidence that okay, I know the procedures which are expected from me, definitely you can venture into something else. There's no harm in doing that, and that is true for medicine, for surgery, for gynae, anything. So the key point here is that you should utilize the limited time of clinical posting that you have. See, you have 4 huge subjects and you would be posted in the ward and you have a limited time. So you can't just be in the surgery ward for say 6 months, right? Maybe you'll have 2 weeks or 3 weeks or a maximum of 1 month posting. So within that time, please make sure that you have watched the important ODs, you have watched the important minor surgical procedures as well, you have examined a lot of patients related to the cases that are expected in the exam, and please do arrange for the cases yourself. Please have that enthusiasm. Ask someone, ask some senior to introduce you to the cases that you need to know. Sometimes what happens, maybe a group of 5 or 6 people go to the wards, no one pays them any attention, no one even looks at them, and they sort of feel lost, they sort of feel out of place, and they just come back, and from the next day they decide that we won't go to the wards anymore because we don't get the attention. See, you can't get attention if you are in pre-final or final year. You are no one. Just accept it, right? I used to go to the ward in my second year, and after people used to ask me my year, they used to sort of laugh at me also, that what are you doing here? Just go and enjoy your college life, or go and study pharmacology or pathology. You don't even know the basic sciences. You've just studied anatomy, physiology and biochemistry, so what are you doing here? So the thing is, if you are really interested, you can overcome all those hurdles, you can overcome all those statements of people. You don't need to bother about it. So at this stage, at the pre-final and final year, your focus should be on utilizing your clinical posting as much as you can, and for that, please don't pay any attention to what someone else says. Just approach a senior, approach maybe an assistant professor, and request him that, sir, please teach us this case, or at least please tell us whether this case has been admitted and which bed number, etc., so that we can elicit a proper history, we can carry out a proper clinical examination. So you need the patient, right? Even if no one helps you, you still have a guidebook, you still have videos by which you can learn clinical examination. But without any patient, you can't carry out any clinical examination, right? So you need to know whether this patient has been admitted, and for that you need to be a little enthusiastic, you need to be a little more daring, right? A lot of people shy away from the wards. A lot of people feel afraid, feel apprehensive in going to the wards, and they sort of get confused in front of all those patients' relatives, other hospital staff, seniors, etc. See, I can understand that you may be the youngest person in the ward at that time, but you have to pass the exam, right? You have to become a doctor yourself, and you need to know, you need the patients for your knowledge, right? And for that, you should cross your limits if need be. Don't go and humiliate any senior or any professor, of course, but please be enthusiastic, please be excited, okay, about attending to patients, because that is what we need to do in our real life. That is what we need to do throughout our whole life, that is attending patients. That is what a doctor is. So if you can utilize your clinical posting in each and every subject, in medicine, in surgery, in obsgyne, in pedi, at the end of your clinical posting, say at the end of 6 months or final year, you would realize that you have actually gained a lot of knowledge, even without maybe memorizing each and every word of the book. What you had done is, you had attended to the patients, you had attended the wards, the clinical postings, the practical demonstrations, and you have handled the instruments, you have watched the OT, you have carried out the procedures that are required, you have watched a normal labor, you have watched a cesarean section. I am talking about all subjects here. And so at the end of 6 months, you would automatically realize that you actually know a lot. A lot of people can't accept this fact that they actually know a lot. You have spent at least 4.5 years in the medical college, right? And believe it or not, you have some sort of peripheral knowledge that flows into you. You won't realize it until and unless someone asks you about it, until and unless you visit a patient in the ward. Because a lot of time what happens, the patients start asking you questions, start consulting you when you would take history, right? Because they have been giving this history to a lot of people and no one has paid any attention to it. If you are enthusiastic and if you are listening to his history properly, then he might tell something to you, he might consult you. And when a patient in the real world consults you, sort of everything that you have learned so far, everything that you have acquired so far, sort of falls into place, and you can answer, you can at least give him some advice, and you would realize yourself that you have actually learned a lot of things about medical. It can be medicine, it can be surgery, it can be anything, right? You don't need a book to answer the queries of a patient a lot of times. So you would realize this not at this stage, after say about 5 to 6 months, after you have completed, after you have gone through your clinical postings. So after that, what you need to do is augment your knowledge from the books. That is what is needed. So let us talk about preparation for the exam. Now the exam has two parts, theory as well as practical. So you have studied the practical part very well via the clinical postings, and believe it or not, you have actually studied a lot of theory too, because the cases that you have reviewed, the patients that you have visited, they are all theory topics ultimately, right? Suppose you have visited a patient with CA colon. So CA colon is a theory topic as well. So once you study about a patient who is suffering from CA colon, you study about CA colon, you study about the pathophysiology, you study about the clinical features, the investigations, the management, you study about everything. So actually you have studied a great chunk, a very good chunk of the theory as well. Yes, maybe there are some topics in theory which you won't find in day-to-day clinical practice. Number one is general surgery, like say shock, wound and wound healing, sterilization, stuff like that. Yes, definitely you need to study that. The second thing is some other conditions, especially the super specialty ones like cleft lip and palate, some urological problems. Maybe you haven't seen a patient with epispadias or something like that, because those patients usually land up in pediatric surgery or neurosurgery or some other super specialty, which you don't have a clinical posting, right? You only have clinical posting in general surgery, and that is why you actually go through a lot of general surgery cases. But yeah, there are some super specialty cases which you need to study from the theory. But the rest of it, believe it or not, you have already studied via your clinical postings. In gynecology, you have been to the labor room and you have witnessed a normal labor. So you have studied about the normal labor, you have studied about the sequence, you have studied about the principles, the procedures, everything. If someone asks you the sequence of normal labor, you don't have to sort of memorize it line by line from the book if you have watched a normal labor. So this holds true for everything. This holds true for medicine, for surgery, for every subject, right? Holds true for orthopedics, holds true for anesthesia, everything. Suppose in your final year you get a question on anesthesia, a short question on pre-operative evaluation or pre-operative checkup. Now if you have been to the surgery outdoor, you have seen that after a surgeon decides to operate a patient, he sends the patient to the anesthetist for a PAC, that is pre-anesthetic checkup. And what the surgeon actually does is he orders some investigations. If you have seen the prescription, if you have seen the outdoor ticket of the patient, you know what investigations the surgeon is carrying out. And if you visit the surgery OPD for say 10 days, you don't even have to remember as such the investigations. It would come automatically. Hemoglobin, TCD, CSR, BTCT, everything, PTINR, everything would start coming automatically, because everything has a principle, right? Because we don't carry out investigations just like that. We need to monitor some parameters before we carry out an operative procedure, right? So you would definitely already know the pre-operative investigations that are done, and you also know the reason. After the anesthetist goes to the pre-operative evaluation, he either accepts the patient for the OT, that is allows him for the operation, or maybe refers the patient to a doctor. For if he has a cardiac problem, refers to cardiologist. If he has some renal problem, maybe refers to a nephrologist, like that. So if you have watched this thing happening in the real world, and if in your exam you get a short note on pre-operative evaluation, you can write it. You know why pre-operative evaluation is done, you know about it, you can write it. You know what investigations are done in a pre-operative evaluation, you can write it. And you know what the fate of this pre-operative evaluation can be. It can be either yes or it can be either no, right? So even if you have not studied this short note in anesthesia and you have gone to the exam and in your question paper you see this question, there's no need to panic, right? If you have been to the clinical posting. And that is why I cannot stop emphasizing on the importance of clinical posting and being in the outdoor, being in the wards, being in the OT, being in the labor room, anything, right? So you have to be there. You have to be in the real world to, number one, learn the things in the best manner, and number two, face your exam. Just as I had said, there is no prescribed syllabus for the final examination, and an examiner may ask you anything. But normally it has been observed that students who have completed their clinical posting seriously, who have visited the wards adequately, can answer those practical questions which are maybe not written in any guidebook, not written in any notes, not shown in YouTube videos, right? They actually occur in the real world, and you can't just click everything and put it into YouTube or any app, right? And that is why attending the clinical postings are of utmost crucial importance, and there is no denying this fact that you have to do it. There can be an exam the next day, there can be your maybe tutorials, there can be anything, but you have to attend the wards, you have to attend the clinical postings, and that is the best way, that is the best strategy to ultimately face the final exam, because the final exam is nothing but an amalgamation of all the clinical postings, of all the experiences that you have gained while in your clinical posting. And to augment that knowledge, you need the book, you need some extra help. Lastly, let me discuss how Surgipedia is going to help you. In Surgipedia, I have talked about a lot of theory topics that are important. I have talked about a lot of practical topics that are extremely important. We have provided question papers. More or less past question papers from all universities are included in the QBank, and we'll also provide mock tests, full syllabus mock tests periodically. So what you can do is, at this stage, please watch the practical videos first, preferably, because you will be attending wards as soon as this lockdown is over, and you need to carry out the procedures, you need to answer regarding the practical part more. Apart from that, you have theory, In theory, you have surgery, you have ortho, you have anesthesia. So before the exam, go through the theory lectures, try to form an idea in your head and try to write the answers yourself. Ready-made answers can help you just before the exam, but please don't run after ready-made answers at this stage, because as I have said, there is no particular pattern, there is no particular prescribed syllabus in your final exam. There is even no paper 1 and paper 2 division. I have faced it myself. So just don't divide between paper 1, paper 2, day 1, day 2, nothing. Just study as a whole, right? And anything can be asked. Anything can be asked. And for that, you need to have a good concept and you need to extrapolate your knowledge. Study this much, but apply to this much. That is the main strategy of this final exam. And Surgipedia is definitely going to help you in gaining that concept and in having a portable help anytime you want. Suppose just before the exam you want to go through a topic, just visit that lecture, play it in 1.5x, play it in 2x, and you can have a rapid revision. Before appearing in the Viva, suppose you have forgotten about the instruments, just go through the video of instruments, play it in 1.5x or 2x, skip the instruments that you know, and you can definitely revise in a quick manner. So first have the concepts, watch the videos in a proper speed to understand the concepts, and before revision definitely you can speed it up and just go through the video to revise in a very quick and efficient manner. So with this we end the discussion on how to tackle the final exam. I hope you have understood the strategy. I hope you have understood the importance of clinical postings, and I hope that you enjoyed this video. Thank you so much.